Joining me now is Dr Lynn Burmeister, a Melbourne-based fertility specialist and medical director at Number One Fertility. Doctor, welcome to the program. Thousands of couples and families are going to be impacted by this decision. What has been the reaction among your patients so far?
It's a terrible decision, Rita. I'm just shocked. After living with this pandemic for 2 years, we've actually been stopped and started 5 times. And it is terrible. The patients are hysterical. We're receiving hundreds and hundreds of phone calls a day with hysterical patients calling and begging to start treatment. Can't we make an excuse for them to start? You know, at the moment, all IVF is to be stopped. So any patient that needs an egg collection has to stop, and we don't know when it's going to reopen. We were promised today they're going to do everything they can to reopen. Well, what do you need to actually do to reopen? Please just say yes. So please just say yes that you can reopen. So, yeah.
There is so much that goes into preparation and planning for IVF, and a 90-day pause. What's going to be the impact of that for women who are nearing the end of their fertility, who are around the age of 40? Could this be the difference between becoming a mother and perhaps never realising that dream?
Yeah, definitely. So all my patients are fertility challenged. They don't do IVF because they just feel like it. They're all fertility challenged. I've got 30-year-olds that are running out of eggs. I've got, people like Melanie that are 45 running out of eggs. So everyone is reproductively challenged. They're not putting their hand up and saying, I want to do IVF because I can't get a baby naturally. These people have tried and tried and tried, and they've prepared for months to start their IVF journey. And, Melanie was day 1 of her cycle today. She can't start this month, and she only has another few months left before she does turn 46, and then IVF is not available for her anymore. So this is so devastating. There's so many people like Melanie that are out there that cannot start their treatment, and 3 months is too long. We've had this happen so many times to us where we've had to tell patients over the last 2 years that they can't start treatment, and I think we're just all sick of it. It's enough. Like, please let these women start. We don't use the resources that are needed for COVID patients. We use one needle. The patients are under sedation the whole time. They're not intubated. It takes me 15 to 20 minutes to collect eggs. The patients go home within 2 hours of the procedure. They don't get admitted to the hospital, and they rarely have complications.
Well, that was going to be my next question. Is this actually going to relieve pressure on the hospital system? And will those working in fertility be deployed elsewhere in the system? Does this even make any logical sense?
It makes no logical sense at all. So this morning I did some egg collections because they were allowed to start a couple of weeks ago. So we're winding up our egg collections now. And the theatre nurses that were in theatre with me were going home after the few egg collections I had this morning. Yeah. So no, they weren't being deployed to the COVID ward. They weren't being told to go to the public hospitals to do work. They weren't being deployed anywhere. They were going home. They were told to go home after they finished my list. So no, the staff are not being deployed to work in public hospitals where they are struggling with COVID patients. And also, my fertility nurses can't work on a ward with COVID patients. They wouldn't know what to do. They're specialised fertility nurses. They can't be deployed to work on a ward with sick COVID patients.
Now, you mentioned you've had hundreds of calls from devastated patients. What would be your message to Premier Dan Andrews and his government? What can you say on behalf of the IVF community?
I am the patient advocate because often they don't have a voice, so I'm out there for my patients. And I am begging you, Dan Andrews, to change your decision immediately. Don't even think about it. Melanie needs to start her IVF cycle tomorrow, as do hundreds of other women. Please reinstate IVF now. It just needs you to press the button and say yes. These patients need to continue treatment. Time is of the essence for them. They might be missing out on their baby egg this month. So your decision might stop someone from having a baby this month.
Doctor, thank you so much for your time. Appreciate you joining us on Inside the News.
Thank you, Rita.